Professor Feinstein is Professor of Education and Children's Social Care at the University of Oxford and Director of the Rees Center. He's undertaking work on the measurement of need and risk of children and working with local and national agencies to improve use of data to improve children's lives, experiences, and outcomes. Liam was Director of Evidence at the Office of the Children's Commissioner from 2016 to 2019, and from 2013 to 2016, Leon was Director of Evidence at the Early Intervention Foundation, an independent charity and What Works Center, working to evaluate the impact of early intervention. From 2008 to 2013, Leon was a civil servant working in the Treasury and the Cabinet Office on policy implementation and performance policy. And before joining the civil service, Liam was a professor of education and social policy at the Institute of Education. In this period, Leon's academic research concerned the intergenerational transmission of advantage and disadvantage in terms of social structure, education, and income. So we're very lucky to have him with us today. And so with that, the floor is yours.
Thanks very much, Ben.
All right, and I'm noting that I've done something silly, so they can't see the slides online. So let me just get that sorted really quickly.
You sort that out.
Yeah. Too many cooks in the kitchen. Let's see here. Apologies for the technical hiccup, everyone. This should work. Yep. Okay, there we go. Over to you.
Done. Thank you. Rather you than me. Hi, everyone. Delighted to be here. It's fabulous to be in this department, at least for this seminar. When I was at the Early Intervention Foundation, we were desperate to recruit the graduates of this department because they had the right training and skills, and when we had a number that came through and were fantastic. So yeah, it's a real pleasure to be here, and thanks for the invitation. Thanks everyone for coming. I want to talk about work that I did at the Children's Commissioner's Office, and reflect a bit on the challenge of why we do measurement and accountability. So I guess for people who are thinking about evidence-based policy, you're and not that everyone here is, but that you're in the business of specific interventions and trying to understand about the impact and the effectiveness of those interventions. The question that I've been asking is more about the state of the nation. How are children doing? Not about, do we know whether intervention X will make a difference, although those two issues are very related. And I would say if we had better measurements of outcome and need, we'd have a better basis for thinking about impact. And so there is a relationship, and not least in the question of how you define and measure outcomes when you think about an intervention. And part of my core thesis really is that there's a problem in government that people are encouraged to think that with one or two variables you can understand very complex things, like the children's social care system or the well-being and welfare of children. That you can measure that with one or two variables. And the construct that I'm interested in here is children's need. I'll talk about work that we did at the Children's Commissioner's Office, and if we have time, a bit into how that's evolved and where that's still going. But the essential question was, if the Children's Commissioner, so Children's Commissioner's Office was set up in 2004 Children Act, which established the Children's Commissioner as a independent voice for children within policymaking. We're now on the fourth Children's Commissioner, and they've all interpreted the role in different ways, but it's very influenced by the United Nations Convention on the Rights of the Child, Article 12, that the voice of children should be heard on matters that affect them. And there's a huge challenge there about how do you hear the voice of 12 million children? But until 2016, the office had mainly been focused on voice and qualitative work and hearing the voice of children. But the 2015 Children's Commissioner, Anne Longfield, wanted a bit more quantitative definition about her role. And so the part of the 2004 Children Act is that the Children's Commissioner should be the voice of invisible children. and the most vulnerable children. But how do we define those things? How do we define invisibility or vulnerability in childhood? And so I was recruited, or the Children's Commissioner recruited a head of evidence to run a quantitative function in that office to try to get a measurement of vulnerability and need. And that's important for a number of reasons. The core issue for the Children's Commissioner was that we might have an evidentiary basis for setting the agenda of the Children's Commissioner. So the Children's Commissioner has the powers of data request from any body working with children, any public body working with children. The Children's Commissioner can write to them and request information. She can visit, she can inspect, and she can challenge, and she can write letters to any permanent secretary in government and ask for information concerning the activities of that department in relation to children. So she has powers to inspect settings and powers to request data. But her question was, well, where should she focus those powers? And you could do that role driven by your own knowledge, as other commissioners have. You could do it driven by what is in the newspapers on any given day, as all commissioners will do to a degree. And that has to be part of it. But it should, and Longfield, as Children's Commissioner 2015, took the view that we could try and create a bit of a evidentiary framework for thinking about need, to set the agenda of the office, where those inspections should be, where issues are, drawing on the best research. So that was from the Children's Commission standpoint. I think it's also important from the standpoint of trying to influence central government policy making. So there was a debate. It's very hard to talk about policy in this country. Who's the Chancellor, who's head of the Department for Education this week? You know, it's been very difficult for a number of years. So I can't remember exactly which putative spending review we were trying to influence. But at that point, the Local Government Association, which represents local government who deliver most of the services for many of the most vulnerable children, their view was there was I think it was a £2 billion or possibly £3 billion black hole in children's services funding. And the way they'd worked that out was they had a projection of the number of children who were being referred into care. So I'm going to talk about different groups of vulnerable children, and the language for that is much less straightforward than we might hope it would be. But I'll talk about looked after children, for example, who are children who are in the care of the state. They've essentially, for various reasons, through different legal processes, they are now not in the care of their parents. They are in the care of the state in some way, looked after by local authorities. And the number of such children had been growing over a period of years and was projected to continue to grow, and the funding had been coming down. So just based off those two, the scissor graph of those two lines, there was going to be a gap of, I think it was £3 billion. It must have been about 2019 at that point. And it was a powerful analysis, but it bore no relation to the actual needs of children. Were previous levels of funding sufficient? It couldn't answer that question. So it seemed to us quite a superficial, but the best possible attempt that could be made to answer a Treasury question for a spending review. Treasury question being, how much should we spend on looked after children? And the numbers are growing, so unit cost has to continue to grow, and so there's a black hole. But how do we think about the problem of, well, what would actually meet the needs of children? To answer that question, you've got to have a framework of need and a kind of way of measuring need. And I don't say we've answered that question, but that was really part of the framework of what we were trying to answer. So I will talk about that. I want to emphasize, and I emphasize this much more since I'm an academic than I ever did at the Children's Commissioner's Office. This is in a framework of rights and the rights of children. And I was delighted to discover last year when teaching a course about child rights that Eglantine Jebb, who some of you will, I'm sure, know, was at Oxford, Lady Margaret Hall, in the early 20th century. And she was one of the two British women who set up the Save the Children Fund, which was established to protect the children in the defeated nations of the First World War. So children in Germany and Austria were starving and going hungry. And Eglantine Jebb, as an Oxford person, she was an academic, I think, but also a kind of member of the British establishment, but took the view that we ought to be making sure that children going hungry in Germany and Austria should be fed, and was very brave in making that case. And she would regularly have eggs thrown at her and be accused of being a traitor. But she insisted on the rights of the child, and she set up with her sister Save the Children Fund, and she wrote in 1923 her Declaration of the Rights of the Child. This was her framework for thinking about how we think about responding to the needs of children. The child must be given the means requisite for its normal development, both materially and spiritually. The child that is hungry must be fed, and so on. And I emphasize this because those 5 articles, which she wrote at her desk in Lady Margaret Hall, a year later became the Declaration of the Rights of Children at the United Nations. So it was just a very impressive example of, those very rare moments as an academic. You write something and it kind of has real impact. There won't be many like that, but she drafted these things, and 80 years later, in various forms, that is the United Nations Convention on the Rights of the Child. We have a lot more articles now that unpack these things. But essentially, these I would say these are about meeting the needs of children. But you're left with the question: what are the means requisite for normal development? It's kind of a big threshold question. At what point of hunger must the child be fed? How much feeding should there be? Some of the language now is quite dated. The child that is backward must be helped. We wouldn't use that language now, but raises the question: how do we define that, and how do we assess how we're doing on those things? So I'm very interested in the question of how we deliver on the rights of children. So that this work is rooted in these rights as a matter of ethics, but I'm interested in the practice, the delivery of these rights. How do we know how we're doing? And so this work was about trying to create a framework for comparative analysis to assess the numbers of vulnerable and invisible children, to monitor their well-being, and to assess the quality and impact of public services within that framework. That was the point about this work. But the work wasn't evaluating impact. It was about trying to understand how we define outcomes within that framework of rights in a way that could help shape the agenda for the Children's Commissioner's Office and for others, and to understand levels of need. So to do this, we did a number of things, and these were some of the early requirements. Because this was work done in a public body, peer review was essentially me talking to the Commissioner, talking to academics, getting feedback. But essentially, I then ran the project as I thought right. So it wasn't an academic project. But I thought it was very important that we had both quantitative and qualitative information. And that's partly because of the UNCRC Article 12, but also if we want to understand well-being and welfare, how far can we go just looking at large sample quantitative data? And if we want to understand the needs of children, then hearing from them, I think, is essential. So that's Article 12 of the UNC, and I agree with that. But we also wanted to emphasize financial information. So the kind of starting point questions were: how many children have needs that can't be met in a simple way by their families and by universal services available to them? What are the needs that go beyond just what schools and families can meet, where additional services are needed? How many children have such needs? And qualitative information, what are they saying about their experiences? How much do we know about the voice of children, particularly the most vulnerable? But also, what are we spending on these different groups? And when I set off on this, I thought we'd have a fairly clear idea. England, and this is for England, the Children's Commissioner is the Commissioner for England. They're separate commissioners for the other nations of the UK. So I'm talking about England here on the whole. But I thought, having had a career in cohort studies analysis, I knew about the Millennium Cohort and understanding society and these huge data sets that Britain has, that are the crown jewels of British social policy analysis I've read many times. I thought we would know a lot about the needs of children. But once you're looking into vulnerability, turns out we actually know very little. And obviously there's no financial information in those sorts of data sets. But we reviewed what do we know about what we're spending on each of these children, how many are there, what do we know about their characteristics, and what do we know about their experiences, what they say about their experiences. So to do this, we tried to develop a taxonomy. That was our approach to defining vulnerability, and I'll talk more about that. I emphasize this distinction between things, numbers, and words, because I found quite early on, most of what people wanted to talk about was the labels that I gave things. And this is a big issue in social policy, in social research, in the academy, of what we call things. We could have spent the whole time discussing what we call these different groups. And I think that's an important debate, but I didn't want to get overly distracted by it. And the distinction between things and numbers is also really important. I wanted to emphasize, to come up with a clarity of construct that we're trying to measure, and then review the data and see, well, to what extent can we measure that construct? But that distinction is really important, because I see a lot of work in government which is based on, these are the data sets we've got, what can we do if we bang them together, without any theory really of what are we actually trying to measure. So I wanted to emphasize that distinction. And we talked about the kind of triangle between these three things, all of which matter, but we don't have a lot of clarity on the relationship between in measurement terms. And then levels of analysis also really important, and is a real challenge in the business of measurement in policy. And to give an example of that, I tend to talk about school performance. So we want to hold the Secretary of State for Education accountable for the quality of education in England. And so we measure exam performance. That's a key determinant of, or a key outcome of education policy, is school success. So we measure how children do in maths and reading at age 7, 11, and 16. We measure all children. We do that for a number of reasons. One is to hold the Secretary of State accountable. The other is to hold schools accountable, and also to hold teachers accountable, and also to help children and their families learn about how they're doing. But we have one measurement that is supposed to do all four of those things. And I would say it fails at most of those things, because it's not clear which of those things it's actually trying to do. If you were trying to create measurement to help children understand how they're doing in school, you wouldn't need to measure every child on a consistent test. I would argue, at one point in the year, it would be much more formative experience between teachers and pupils and parents. And similarly in relation to teacher accountability, there are huge problems about teacher accountability being based on the measurement of the outcomes of children that pass through their school, rather than on the quality of their practice. Big debates about those things, but my point is that you have to be very clear about the level of measurement and the relevance of the construct to the level that you're measuring. And very often our measurement systems aren't. So we wanted to be clear about that. So what did we do? Essentially, we reviewed use of the term vulnerability in policy literature from about 2000 to 2018, to see the different ways in which the term vulnerability has been used. So this was a construct that I didn't define from pure theory. I simply explored the way in which it has been used in practice. And there were some quite interesting findings that came from that that I'll talk about. And then we looked at, well, to what extent do we have large sample information on the numbers of children and their characteristics that had these different forms of vulnerability on this definition. And then we tried to estimate the adding up of those numbers to get to kind of aggregate definitions of need and measurements of need, and I'll talk about that as well. We also looked at, as I say, at where money goes, and we conducted deep dives into specific groups where we reviewed the qualitative literature on their experience, and we also did consultation on this term vulnerability. I've mentioned language a lot, and the term vulnerability was hugely problematic. It was a necessary term for this work because it was the Children's Commissioner's term. In her remit in the 2004 Children Act, it talks about vulnerable children. So she wanted to know, what does that mean? But when you use that term in public debate, then it starts to become a label that is being applied to particular children, and that was very unpopular. It was an interesting issue, though, in terms of trying to do policy and practice. Boris Johnson, as Prime Minister, was concerned about vulnerable children. So the Children's Commissioner could get attention and an ear in Downing Street by talking about vulnerable children. If she only emphasised assets and strengths of those children, there's no debate to be had. So, but so there is an argument for using that sort of language, but it needs tremendous care, and I don't claim to solve that problem. Anyway, we use that term. I found it very interesting. We discovered 72 uses of the term vulnerability in relation to children that were clearly distinct. 72 clearly distinct uses of the term vulnerability. And I think the classification framework is a useful thing, and I will go through it. But this was just our attempt to taxonomize around what we discovered. There was an essential shift that happened in that period through Every Child Matters. And so that for students of English social policy and early years policy, Every Child Matters was a major achievement, I would say, of the New Labour era in creating a common framework for understanding early years development of children and policy. But it also, and more generally, the New Labour government aligned and integrated two broad notions of vulnerability, which hitherto had been separate, which were one, vulnerability to serious harm in the sense of neglect, violence, trafficking, sexual abuse, child protection type needs, safeguarding, we would now call it. That's the territory of child protection, essentially, and the courts and social work. And that became conflated in Every Child Matters with other forms of vulnerability, which were much more about disadvantage. So unfairness, the vulnerability to lack of a level playing field, inequality, poverty, essentially, but also other forms of disadvantage. And the term vulnerability, and you find in lots of documents, describing aspects of childhood that were much more about disadvantage than about risk of serious personal harm. And so when we explore these components of need, we are looking at two quite different notions that have since been a bit separated out, I would say, from Cameron on, into a kind of social justice and a social mobility agenda. So Theresa May would talk about social justice and the protection of the most vulnerable, very concerned about child trafficking and those sorts of issues. But that's distinct from a social mobility agenda, which was more the kind of, how do we support working class children to go to university type issue. This term is used in lots of different ways. But we found 72 different notions and classified them. And the classification, I think, is useful because it provides a broad framework for thinking about need. So one set of categories, and I won't go through the 72, although they are on the subsequent slides, but one set of categories was essentially children receiving statutory care or support. So these are indicators of need. That is to say, one of the categories would be children looked after. Children in need, which is another legal category following the Children Act, which requires a response from local services where the child will stay on the whole living in the family home, but will receive additional support. It's a statutory category. It doesn't in itself tell you very much about the child, except that they have been deemed to be a child in need, and therefore we might assume there is a level of additional need. Although when you look into it, it's a tremendously variable grouping, but it's an indicator of need. Another key one there is children who have special educational needs or disability, children who've been assigned as having special educational needs or a disability. So they have a statement and they've been through a formal legal process, and therefore there's an indicator of need. That's one indicator, one type of indicator. Second set of categories was more about children who've where the label is about some form of specific personal harm. So children who have been abused or exploited, children who have been maltreated. Obviously, a strong relationship to the first set of categories, but it's a different lens on those things. So we might assume that every child looked after has experienced some form of personal harm, but actually not. We don't know that that's entirely true, and there's huge variability in that. And of course, there are many children who've experienced maltreatment who are not looked after. So different set of categories and a different lens. Third set of categories was children with a disability, ill health, or developmental difficulties. So these are characteristics of the child, I would say, although from a capabilities framework, it's always a child in context, but where there's an indicator of need and there's a concern about the physical or intellectual development of the child, and that's the indicator of need, a different set of categories. Fourth set of categories, which was really challenging to name, and I have to say the comms team at the Children's Commissioner's Office was very unhappy with this label. Children in households or families with characteristics or locations that indicate higher potential likelihood of current and future harm. It's not very catchy, but it avoided some of the challenges of labeling that you get into very quickly in this category. The main indicator in there is family poverty. But we're also concerned about children living in circumstances where there's domestic violence in the home or mental health issues in the home, drug and alcohol use, and so on. But these are about the characteristics of the home life, of the family environment or the home environment of the child. And often those obviously are big drivers of need. Fifth set of categories was children vulnerable by virtue of their identity or nationality, and the big debates here about which group should actually be included as in need. And I need to say a word about assets and strengths, because that's really important. And you can't really understand vulnerability without understanding strengths and assets in a kind of holistic framework. I need to say that, of course, every child is vulnerable. Childhood, to a degree, we might think of as a developmental and formative state. So every child has a degree of vulnerability, but this was, as I say, is about additional forms of vulnerability and need where there is where those needs cannot easily be met by the family and by universal services. Identity issues get really difficult, where you would classify, for example, ethnic minority children. Is that a form of vulnerability? I would say not. But you might have concerns about some groups, and therefore there's an issue that needs to be monitored. So we had those debates and ended up including some forms of nationality and identity, particularly Gypsy, Roma, and traveller children. Particular focus here was nationality and immigration status, which was a huge issue and has grown since. And if I've got time, I'd like to talk more about that. Sixth set of categories we call children at risk in relation to activity or institutions outside the home. This is really about where the indicator is, these classifications. So these category 6 is about where the indicator is linked to the child in the child's life outside the home. So that might be children in gangs is a big one, and really difficult to define and measure. Children not in young people not in education, employment, and training is another classic one in this area, where the indicator is linked to the status of the child or the young person as they develop. And there are a range of categories there. And then lastly, children caring for others. This was essentially teenage parents and young carers. Young carers has been a big concern of the Children's Commissioner's Office. These are children who are often looking after siblings or parents and so on. And they should be children in need in terms of getting support from local authorities, but they don't. So 7 categories, and the point about that is it spans different domains of policy. And that was very important for the Children's Commissioner's Office, that part of the challenge we have in policy making is departmental silos. And children span those. And so it was very useful to have a framework that could engage the health department and the education department and the welfare department and the housing department and so on in a common conversation about levels of need. And I personally, I think that's very useful. So for these are the 7 high level categories, but we had the 72 indicators underneath. I've just listed them here, and I'm not going to spend time on them. But the to be scoped, again, I'm not going to spend time on, but just to emphasize, it wasn't supposed to be a fixed and closed list. There are gaps in there, and new concerns will arise all the time. So it needs to be a living thing if it's going to operate. And I'm going to talk a bit about what we found, but within that, I'm mainly going to emphasize what we don't know. But I'll talk a little bit about some of the things we did find and the challenges of aggregation. So if you think about those need types, I'll talk about category 4 actually. Children in households or families with characteristics or locations that indicate higher potential likelihood of current or future harm. So children and young people in poverty is a really big group there, but we might be interested in the intersection of that and children with mental ill health in the family, for example. Children of prisoners is a fairly small group, but a very vulnerable group. But to know that whether a child is that is a child of a prisoner is vulnerable, you need to know some of these other characteristics as well. So going back to the point I made earlier about assets and resources, without knowing about the assets and strengths of the child and the family, you can't really say anything about vulnerability. So these are just single indicators. And what we wanted really was a way of understanding the intersectionality between these indicators. And that relates to the challenge of aggregating, because if we want to know, okay, how many children have got any of these things, you have to know about the intersections between the categories to avoid double counting. So we were very interested in the intersections between these categories, and we tried to do aggregation because aggregation would enable us to get to the black hole question that the LGA was asking, which is essentially how many children might there be out there that need children's social care that aren't currently getting it. So we need to know how many children are currently getting social care. Well, we know that. How many children are living in circumstances or have characteristics that indicate they need additional help? That requires an aggregated analysis. So we tried to do that. I'm going to talk more about the gaps in the data, but without giving the story away, because we know so little about the intersections between those categories in terms of numbers, it's very, very hard to do. But we found some data sets that were large sample and included information on children and parents. That's the first gap, is most data sets either tell you about the parents, but then you don't know about the child, or vice versa. Or many of these indicators are missing from our big national data sets. So Millennium Cohort made a decision not to go to residential settings where children are living away from their homes, because that would have been difficult, it would have been expensive. I've seen papers that indicate that people were worried about the safeguarding implications of interviewing children in residential settings. I can tell you that made the Children's Commissioner very cross, because that's not actually safeguarding, that's avoiding safeguarding. But there was a cost issue, I think, at the heart of that. But many other vulnerable groups are also either not identified in that data set because the variable isn't there, or they were just missing from the data set entirely. And if you think about homeless children, Gypsy, Roma and traveller children, children with insecure immigration status, many of those groups will be mobile and living in fragile circumstances, and they're not available to the Millennium Cohort and these other data sets. And the numbers that you get from those data sets are very different in terms of the most vulnerable than you get from administrative data. So it's quite hard to find data sets that would enable us to know how many children are living, let's take those 4, in serious poverty with high levels of alcohol or drug misuse in the home, mental health issues in the home, or domestic violence. We found one data set from 2016, I think it was, which was a psychiatric study, which studied the mental health of parents, but it also asked questions about the numbers of children. And so we got an estimate from that of how many had 1, 2, 3, or 4 of those categories. It was 2.3 million children as of, I think it was 2016. Quite dated as we were reporting this in 2019. There was a lot of error in that number. There were sampling biases and all sorts. So, saying to government there's a margin of error of 300,000 on this number was not very persuasive, but that was the truth. But when we came up with that number, 2.3 million children, which is 1 in 6 children in England had one or more of those characteristics. First question you may ask is, but what is the threshold? So this is the huge issue. At what point do you say a child is vulnerable by virtue of the alcohol use in the family? There was a lobby group that was saying it was, I think, 3 or 4, 5 million children were experiencing serious alcohol use in the home, but their definition was, I think, more than 2 drinks on any one night in a 2-week period, which I thought was... it's going to be very challenging to the Children's Commissioner's office. We took quite high bars on these numbers, high thresholds, which were equivalent to the thresholds that the relevant government department took in their guidance to practitioners. So we took a high bar. So, it was a high level of alcohol use, high levels of domestic violence before we would say this is triggering a concern. And we still estimated 2.3 million children. And I have to say, the Commissioner said to me, could you do a lower number? Because this is too high. We don't know what to do about, this. Because at this point, so we broadly had this rule of thirds when we think about levels of need. So about a third of those children are receiving statutory support through a local authority. There are about 700,000 children at that point receiving statutory support. I have to say a lot of that support is pretty negligible, but they are formally recognised as in need. About a third are known, we estimate, to other bits of government. So they might be receiving mental health support through the Health Trust, even if the local authority, they're not on the local authority books, or they're receiving troubled family support through another bit of the local authority. And about a third were not on the radar of any bit of government. And I'm not saying that all of those 2.3 million children need to go into care. The point is that they all have substantial need that is not currently, for all of them, appropriately flagged and recognised. And I think a good example for thinking about the kind of policy response you might have there, for me, was the National Lottery had a Head Start programme, which was about meeting the mental health needs, low-level mental health needs of children I think it was between the ages of about 12 and 15, where they managed to get an arrangement in some schools where when the police were called out for a domestic violence incident, they managed to find a way to make sure that, and dealing with the data protection and so on, that the school was informed, not what had happened, but that the child had had a negative experience. And somebody would then make sure that that child had a conversation in the following week so that if they did need additional support, they could be identified as needing it. And it was more that sort of level of need. But so, that was our estimate. And that was in 2019. Since then, we've had the pandemic. Those numbers will have grown, but we've lost all the data since then. And in fact, the Department for Education in pandemic redefined vulnerability as being 2 of the categories: children looked after or children in need, so children receiving statutory social care, or children with special educational needs or disabilities. And all those other categories were wiped from Department of Education concern. And that is very worrying. And some of these groups are extremely vulnerable. And some of the most important work, I think, was with the small groups. I'm emphasizing big numbers. But some of the small groups are extremely vulnerable. So a good example there was children in mental health detention. So there are about 3,000 children in England who are under the roof of the state. So they're locked away in receiving mental health support. So with serious mental health needs that hopefully are being met by the NHS. But when we ask the NHS what happens to them, how far are they away from their homes, we were initially told, don't worry about it, it's fine, we're all over it. In a kind of traditional policymaker way, and we said, well, so can we see the data on what happens to these children and how far away from home they are? And they said, no, it's fine, we've got it, don't worry. So we could use the powers of data request and ask Children's Commissioner writes to the head of the NHS and says, can we see the data? They send us the data and it was in a spreadsheet with 90% missingness. So they don't actually know where these children are, what happens to them, what their outcomes are. And many of them are extremely vulnerable and living hundreds of miles away from home. And I just emphasize it to make the point that often it's the small groups where we really need to be most concerned. So, and many of those groups have been under the radar now for 2 or 3 years. So what these numbers would now be, I don't know. And I think it's a contribution to a debate about how government should respond to need. To start from some kind of assessment of, well, what are the levels of need that government is responding to? That's not how government works. And I've had this debate with a number of ministers at different times. At the Early Intervention Foundation, we had David Willits come to talk to us about the fact that it's not the government's job to identify need. Government should be there to respond when people arrive at the front door, which is all very well, so long as the front door is open, but it isn't. There are very high thresholds on these things. So I think we need to understand what's out there that then leads to those referrals into care. And obviously that most people here will agree with that, but we know very little. And I was surprised how little we know. So I want to emphasize some of those points. Findings about the quality of information. Many of these groups, we can't even tell you how many are in the group, just as a single variable. For some reason, for some of these, that's because it's very difficult. I've emphasized here parents with limited parenting capacity, only because government after government has talked about the problem of bad parenting or inadequate parenting or parents that need additional help to parent in different ways, but nobody has come up with a number of the scale of that problem or a very clear definition, although there was work in DWP in about 2018. But so we don't have a number on that. It's not a very clear notion. Undocumented children, obviously that's really hard to do. This is children who are living without documents because they've arrived. I'm trying not to say illegally because that's not the right term, but they've arrived on their own means into the country, or they've been on visas and they've overstayed and so on. And obviously those children are hidden. They are very literally, or not literally, but they are seriously invisible. So it's hard to know the number. There have been various estimates made, but I think important to emphasize we don't know it. Mental health detention is one I emphasized. So partly this is about the difficulty of defining and measuring these constructs. But some of them actually, homelessness, government has made real improvement on measuring children who are homeless. Mental health detention, they haven't. But so some of these constructs are just very vague and really hard to define. Many aren't, and we still don't know a lot about numbers. But that's single variables. Knowing anything about intersectionality is incredibly difficult. So you take any two of these variables, we know very little about the intersections. And there's some examples that we really should know, and maybe now we do. So children who are looked after, so they're in the care of the state, they've gone through a legal process. We know how many of those there are. We know how many children are receiving mental health support through CAMS from NHS statistics. But we haven't until recently known the intersection of those two numbers. So these are two groups in the care of the state in different ways, but we don't know how many looked after children are receiving mental health support. Never mind the question of how many looked after children need mental health support. We've got better estimates now, actually, and I should emphasize, because I'm at the Rees Centre, the work that Julie Selwyn has done on measuring child views and child needs of looked after children, bright spots. But we don't have clear estimates on that. And many of these forms of intersectionality, we just don't have very good numbers on. We know very little about wider context, wider community context, and we know really little about assets and resources. I'm often told I'm emphasizing the negative and the need end of things. Actually, data in our available studies on assets and resources are much weaker even than data on needs, because government puts these questions into surveys because it does want to understand need on the whole, but there isn't a framework for thinking about assets and resources. We reviewed frameworks for understanding family strengths and child strengths, and there hundreds of frameworks, no single one that was operationalizable in any available data. Really, we need to understand the context of the child, the capabilities in the round to understand levels of need. But we just don't have that sort of data, I would say. We were interested in outcomes, trying to understand longitudinally what do we know about the outcomes for these groups on average, because we're saying they're a vulnerable group. Do we see that in outcomes? There are some groups for which we know that, but there are many for which we don't. Children of prisoners, I think, is a really key example. Again, it's a fairly small group, compared to some of these other numbers, but they're not identified in any data, although they could be. So those are the groups for which we have fairly good data on outcomes, but all the other 72 we don't have, because there are no longitudinal studies with them in that we found large sample. There's some real issues about methodological clarity of definition. There is a project in the Office of National Statistics to measure maltreatment and harm, but it hasn't got very far. It is a difficult thing to do, I grant you. I was surprised about the lack of agreement within the NHS about the definition of developmental difficulties or ill health or disability. And I do understand these things change a lot as science evolves and as needs change. But there is no common rubric for defining disability or developmental needs within the NHS. Local authorities and early learning settings have all got their own language again. So there's no common language. It's quite a hard thing to define, although having worked at the Early Intervention Foundation, there's a lot of policy in local authorities that is about trying to identify early developmental difficulties so that you can get upstream and help. There are clear definitions of those things. And then the definition of children who are vulnerable by virtue of immigration status is one I've done work on since, because there was really very little definition of that or measurement. I mentioned money. Really hard to trace the link from spending to any of those vulnerable groups. So we can tell you what is spent on looked after children. That is a kind of official statistic. Local authorities have to report that. But for most of these groups, they can't trace through or who's getting what level of help. How many of their services are to children who are experiencing domestic violence in the home, for example. Got no stats on that. If you want to know about early intervention in terms of, say, language support, so communication skills, huge issue, and we were interested to know what local areas spend to support the communication skills of children who are struggling with communication in early life. Problem there is some of those services are delivered by local authorities, some by the health system, and health trusts commission those services through block grants. So they can't tell you what is spent on early intervention for communication support. So we just don't know. And that's true about a lot of these areas. We just don't know what is spent. We don't know what the NHS doesn't know what it spends on children's health. It doesn't think about spending in that way. Maybe there are good arguments for that. And then lastly, what do we know about the views of children? Again, very, very little. I mean, I think this framework provides a systematic way to review particular areas of concern. And we looked at a range of groups, children in custody, children in gangs, a range of other groups, and did a systematic reviews of what do we know about their views and their experiences from what they say. And we found, a range of studies, but most studies we couldn't use for this purpose because they were very driven by a research or academic objective that was the purpose of the interviews, rather than an open kind of, trying to seek understanding about the experiences of that child by virtue of the risks that they have experienced. So there is a huge amount of voice work that is systematic for understanding the needs of children. That was that. How are we doing for time? I've gone on too long. Can I do 2 minutes wrap up?
Yeah, that's fine.
Thanks. So that was work I did at Children's Commissioner's Office 2016 to 2019. And I think it was useful to have a framework for understanding need and vulnerability that spans the different domains of policy and different domains of childhood and wider context. And so I've not wanted to kind of let it go, but I left the Children's Commissioner's Office. We have a new Children's Commissioner who still owns the measurement framework by virtue in terms of intellectual property. It still sits in the Children's Commissioner's Office. And the new commissioner is interested to retain it, but doesn't like the language of vulnerability, and hasn't invested anything in it recently. But I've recently put in a bid together with Jane into Oxford University to try and raise money to come back to this and to use this framework as a way of aligning and integrating different work that's going on across the university in relation to child need. And I think that's quite a useful thing, so I want to persist with it. And I've also carried on working on the issue of measurement and this challenge of I'm in a perpetual sort of battle with I say it's a battle for me, I don't think it's a battle for them, with the Department for Education in Whitehall about, and others, about data linking. You know, we have to think about what are we trying to measure. And so much of our data is about where people are in the system, where children are in the system, rather than how they are. And Children's Commissioner would often emphasise, we know the age 11 maths score of every child in state education in this country. We don't know if they get beaten when they go home. So, you know, government measures what it cares about, really. And I think there's a framework here that could be used to try to hold government better to account for how children are by virtue of being systematic and holistic. Because I see a lot of charities and lobby groups, and you know, they've got their issue and they're banging on the door of government about their single issue. There's very little work that tries to align that and hold government to account for the general welfare and well-being of children. And I think that's a useful and important thing. I suppose my final point, if we're concerned about vulnerable children and government is concerned about vulnerable children, can you really be confident that those children's needs are being addressed if nobody can tell you how many they are? I would say that's the first question. So, but discuss. Thanks.